Hello guys, welcome back to my channel. The name remains Dr. Brown. I'm looking forward to discussing with you how to assess decision making capacity and informed consent from a patient. So there are four components to assess when you want to assess a decision making capacity of a patient or get informed consent from a patient. So we'll look into the various components for each. We'll start with informed consent. How do we get an informed consent from a patient? This is very crucial. As medical practitioners, we need to get consent from a patient. It's true that a patient would walk into the hospital, obviously to seek help, but at the same time, before we do anything, it's very important, especially for medical legal reasons, to seek consent from the patient before we carry out any procedure. So there's a quick mnemonic. Basically, the mnemonic is DR. You can remember this by doctor, and that's how you remember the four components which you have to assess to be able to conclude that the patient is actually giving you informed consent or not. Informed consent can be verbal or written. It doesn't always have to be written. So we are going to look into the four components. So the four components I said is remembered as DR. Okay, so the first is D. The D stands for diagnosis, and then the remaining three components is R. Okay, so does the patient understand the diagnosis? For example, someone comes, has a fibroid, and you are planning on a surgery to remove the fibroid. You need to explain the diagnosis to the patient, okay, to make sure the patient understands the diagnosis that the patient has a fibroid or leiomyoma, if you want to call it that way. Then the next is the risk and benefit involved of the proposed treatment. Okay, so primary treatment, leiomyoma or fibroid, we can recommend surgery or myomectomy. Okay, so you have to let the patient know the risk involved of when she goes ahead with the surgery, as well as the benefits involved as well. And then you get a response from the patient. Then the next R is the risk and benefit involved of alternate treatment. So, a patient may refuse surgery, but that doesn't necessarily mean that we are done there, because there's other ways of managing a fibroid, like we can give gonadotropin releasing hormones, analogs, which would help to shrink the leiomyoma or fibroid. So if a patient doesn't want surgery, we can still offer some form of treatment, even though we'd have to explain that surgery is preferred. But the patient can still have another form of treatment which would help. So you have to also let the patient know the risks and benefits of the alternate treatment. And then lastly, you have to let the patient know the risk if they decide to receive no treatment at all. Okay, so if you go through all these four components, which again can be remembered as DR, first D and the rest R, then you can absolutely say with confidence that you have gained consent from the patient. Again, this is very crucial, especially for medical legal reasons, especially if you practice medicine in other places where they take some of these things serious. It's very, very important that you get this informed consent and you document this. It's very crucial to get this from every patient who comes in. You can't just assume that once the patient has walked through the hospital doors, they are going to agree to everything. So you have to essentially complete all four components to be sure you've gotten this. Now we have to assess decision making capacity. Okay, so basically this is a way of determining if the patient is capable of making decisions in regards to their treatment, either to go ahead with the treatment or refuse the treatment. So again, we are still using a leiomyoma or fibroid example. So patient has come in, patient has refused all forms of treatment. This patient is bleeding heavily, but patient says, I don't want surgery, I don't want no medications, I want nothing, I just want to go home. For example, a patient who was brought into the hospital by neighbors or family. So you can just go back, take the patient where you have to assess and actually determine if the patient is capable of making such a decision. Okay, and there are also 4 components that you have to actually consider in order to conclude if a patient has a full decision-making capacity. And we can remember this as CURA, CURA. You can just have it at the back of your mind that doctors are curious, right? So CURA is a mnemonic to help you remember the 4 components in assessing decision-making capacity. The first C is for communicate. Okay, so is the patient able to communicate clearly that they do not want the procedure? For example, you tell the patient, I think you would need to have surgery. Patient says, I don't want surgery. Okay, you need to have medication to shrink the fibroid. I don't want it. So patient has to be clear in communicating they don't want the procedure. Then the second thing is, do they understand the diagnosis? Okay, especially do they understand the severity of what they have? Because maybe a patient might not necessarily understand, but when you explain, okay, you have fibroid, it could lead, affect you to bleed. Depending on the location, it could cause you to have miscarriages and whatnot. So you need to make sure the patient understand fully the diagnosis. And if they do understand the diagnosis, but they still communicate they don't want it, that's you checking off the second component of decision-making ability or capacity of this patient. Okay. Now the third is R. The R basically stands for rationale. Okay, so you want to find out why the patient is refusing treatment. Okay, the patient has to give a reason. We need to know. Okay, maybe for all you know, there's a hidden reason why the patient doesn't want to go through with the treatment. Maybe money or anything, religious belief. So if you need to understand the rationale behind the patient, maybe once you address the rationale, the patient would decide to go ahead and receive the treatment, or would change his or her mind in regards to it. And lastly, the A is appreciate the consequences. So, okay, miss, you're supposed to have this, you have refused it. If you do not receive treatment, this is what's going to happen. You could bleed heavily, you could lose a lot of blood, you could have anemia could give you heart failure, blah, 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 right? So you have to make sure the patient appreciate the consequences of whatever they are deciding, especially if they are deciding against treatment. So once you've gone through all this, then you can boldly say that you have assessed the patient, and you can document that the patient has a full decision capacity or capability, and that the patient is refusing a procedure, and then you document. But however, once a patient refuses a procedure or refuses treatment, they're always allowed to change their mind. So if this patient comes in maybe a few hours, or even maybe the next day or something, they are still, and they've changed their mind and want to go ahead with treatment. As clinicians, we do professionally obligated to go ahead and offer them the treatment that they deserve. So this is what I have for today, mainly looking at how to gain informed consent, or how to assess a decision-making capacity of a patient. I hope this mnemonic helps you in your studies and whatnot. Again, the name is Dr. Brown. The channel name is MD Brown. Do not forget to like, share, subscribe, leave comments below, and see you soon in my subsequent videos. Thank you all for sticking and staying with me. Until next time, see you soon.